It is time for Indiana's daily doctor's appointment, I guess you could say, about 2:30 every day, and we'll hear from Dr. Box at the Department of Health.
Thank you, Governor. I have to say that's a tough act to follow, and I think there's no more important message that you'll get today than what the governor just said. So I am going to start out, unfortunately, with some sobering facts. As you can see on the slide here today, we've had 42 new deaths reported in the last 24 hours. I want to continue to remind you that some of those deaths actually reached back as far as mid-March. About 3/4 or 75% of them are deaths that have occurred since Sunday. So most of it's more recent reporting, but some of them do go a ways back. And that is why yesterday in an order I put out that you had to report these deaths to me and positive COVID-19, and that will take effect tomorrow. Also, the next slide here shows you our reported deaths as broken down by our counties across the state of Indiana. These are incredibly sobering numbers, and they're a stark reminder that we have not reached the peak of this pandemic in this state at this time. So what the governor said about social distancing is still incredibly important. And the most important thing I would say after whatever worship service you do, it's not the family dinner with 25 or 30 people there. Even the CDC sent out stories about families that had lost 3 individuals because of meeting just for a birthday party or a funeral. So please take that to heart. Please don't expose any of your elderly individuals in your family to that potential risk. While the number of tests reported to us today is lower than what we've been seeing lately, I want to caution Hoosiers that that does not mean that we're out of the woods. This means really there was a lag time in some reports of labs that were reported to us, and they'll be on the actual report tomorrow. That volume fluctuates daily depending on when they arrive at the State Department of Health, and we always catch up the next day on the dashboard. No one should draw any conclusions based on the number of Hoosiers that are tested. Instead, look at the continued high activity that we have through central Indiana and increasing cases in Lake County, St. Joseph County, Allen County, and Decatur counties. We are nowhere near being through our surge, so we need to continue to stay home and keep talking about the precautions amongst ourselves and with our neighbors that we know you should be taking. To illustrate this point, yesterday our strike team collected more than 500 specimens to be tested. In addition, we held our first drive-through clinic in Lake County at Maryville High School and tested in the first day 225 healthcare workers, first responders, and essential workers, which is far beyond our expectations for that first day. We'll be back in Maryville today, and we will continue to be there through next Monday and probably Tuesday. We're continuing to work on other locations and want to remind everyone that these clinics are for people who are healthcare workers, first responders, essential workers, and who have symptoms of COVID-19. A couple of other quick updates. Yesterday I issued an order, as I've already mentioned, requiring that all labs testing Indiana for COVID-19 report all of their negatives in addition to their positive reports within 24 hours. This order takes effect tomorrow, and we'll be sending out more guidance today explaining how you can do this. The purpose is to ensure that we have an accurate baseline to better calculate what percentage of tests are coming back positive in our state. The order also requires that all long-term care facilities, jails, prisons, or other congregate housing facilities report their COVID-19 cases. Also, if their individual employees become ill, and certainly any COVID-19 suspected death or COVID-19 death needs to be reported. And that way, in that congregate setting, ISDH will know we need to be reaching out and finding out what we can do to help you. It's vital that hospitals or local health departments notify the Indiana State Department of Health immediately when a death occurs because it informs our actions. This requirement will help in that reporting. I also need to address continued confusion about personal protective equipment. The State Health Department has a very limited supply of personal protective equipment, most of which has been donated by individuals all across the state. We have distributed everything we received from the Strategic National Stockpile to date, and we, to date, have been able to meet all the needs of any individual long-term care facility, any individual EMS or hospital that has reached out to us. But it is very important that we continue to conserve this and that you continue to understand that we don't have a huge stockpile right here in the state of Indiana to be giving out. I'm incredibly grateful for the assistance we've received from the Colts and from private partners from across the state who have donated these supplies. We are pushing those out where they're needed as quickly as possible. We're not able to order supplies for hospitals or long-term care facilities. We can supplement their supplies. So we've had a couple of long-term care facilities and residential facilities say, oh, well, we don't need to order anymore because the state has this. No, I need you to continue to work your supply chain and continue to get what you can, and then we'll supplement as needed. Finally, I want to remind people about the importance of social distancing. This is an important week, as the governor just mentioned, for religious observances for people across our state. Those observances need to be different than they have been before. The governor's executive order limits the size of gatherings to no more than 10 people. If you do feel the need to go into a field or go into a parking lot, I would say communion should be brought from your own home. Bring your own crackers, your own juice or sparkling wine, whatever, and take that in remembrance of our Lord. Please don't pass out things. That's where I'm concerned that people could get infected. But if you do that, stay in your cars. Go to the bathroom before you leave, and don't get out of your cars for anything except when you reach home again. I wish everyone a very blessed weekend, and I hope that everyone stays healthy and safe.